We began as a modest program to help the homeless. Now, 20 years later, Unity Healthcare is a comprehensive life net of care for the district's uninsured and underinsured men, women, and families.
Today, we're now serving 57,000 people throughout the whole district, not just homeless, but people in fixed homes, fixed communities throughout the district. And we literally do touch the center of every neighborhood and the heart of every neighborhood in the District of Columbia.
More than 60% of Unity's patients live at or below the poverty level. Many of them are the working poor.
I was without health care for 10, 15 years. So I was basically kind of gambling and living day to day.
Well, I suppose most of us, prior to Unity coming to operate that clinic, relied basically on other health care insurers to provide the services. And usually those services were in Maryland or across town, or anyways, they were really not accessible.
Unity Healthcare has saved my life in literally, figuratively, and in every manner, shape, and form has completely saved my life.
Unity Healthcare is where the people are, working quiet miracles at centers right in the hearts of the communities in which we live.
This is the first time that, in my experience, that someone has come out from a health agency to say, look, we are here in your community, we are here to serve you, please come.
Not having insurance at the time, I walked in one day and just had a cough, and the doctor examined me and he said, yeah, there's a little bronchitis, but I hear something that I don't like. I had an 85, 90, and a 72% blockage. I had 3 arteries blocked as a result of the doctors being very sharp, paying attention to me.
Just because people come to us who are poor does not mean that we can ever accept poor medicine.
Realmente estoy muy agradecida con el servicio que nos han prestado, especialmente con mi madre, porque ella de hace un año más o menos viene bien delicada de salud.
As a matter of fact, 19 years ago, I had a hand injury and went into Unity Care.
My mother just brought me up here, and I started seeing an OBGYN up here.
They provided health care when I had no insurance. They provided health care even after I got insurance. They've been great.
We also have outreach workers who help housebound patients. And you could say we even hold office hours under bridges, in alleys, and in the streets.
We've been doing this since the 1986, 87, where we've had vans on the street looking for the homeless. There are a lot of people who are just really tragically on the street in very, very sad situations, and we're able to reach out and touch them.
I was homeless for many, many years.
Because I was, tired of being homeless and, drinking and drugging.
Well, life now is beautiful, since I got in recovery.
Today, both Mr. Jones and Mr. King help run a shower program that provides the homeless with showers and clean clothes.
That's a part of healing, and not just giving the right pill.
Unity treats people with humanity, dignity, and heart.
There is a feeling of community here. There's a feeling of we're all in this together, and we're all doing the best we can.
The whole person is taken care of.
Like they have the obesity classes, diabetes classes, and even drug treatment classes, because I am a recovering addict myself.
Growing up in Ireland, and still to this day, there's a phrase that says "Céad Míle Fáilte." Transliterated in a transliteration of that, it means 100,000 welcomes. It's an embracing of you as a person. I would like every one of our health centres to be a place of Céad Míle Fáilte, where people could find a home, not only in a place, but also in the care they receive from our staff.
And to walk into the situation there at the shelter and unity, it just tickles my soul, really.
They make it known that you are a part of a team and that your role in the team is most essential in receiving the care that you need.
They make me feel important.
Just keep doing what you're doing. They're the greatest people in the world.
I just want them to keep up the good work.
To see people who, not only in terms of just their particular health problem are improving, but their quality of life is improving. Folks that, because their health is better, are now better able to obtain work, obtain housing. With that kind of support, I think makes a difference for them in their quality of life and in their life expectancy.
Our goal is to continue to expand our preventative healthcare services and to continue to respond to new needs as they come up.
I think miracles do occur every day.
When me and my daughters and my two sons started getting close again, you know, they just always tell me, "Dad, don't worry about us. You worry about getting your life back together. That's the only thing we want our daddy back, you know." So, and they got their daddy back.